Hopefully you're having a phenomenal day, and we are live. Welcome back to another Friday Night Fearmongering. We're going to recap some of the hot stories that hopefully you heard throughout this week, but if you haven't, this is the opportunity to hear all about the Freedom Convoy of 2022, where it's reported about 50,000 truckers all throughout Canada and North America have made the trek from Vancouver, British Columbia on the west coast of Canada all the way to Ottawa. And rumor has it that they are in Ottawa tonight. Meanwhile, the fully boosted and vaccinated President Justin Trudeau of Canada, Prime Minister that is, he is isolating in his home, even though he had a booster shot less than 4 weeks ago, which is quite curious. Then we're going to hear from Jen Psaki. And actually, I want to give a lot of credit to the CBS reporter who asked Jen, hey, look, there's leaders all throughout the world who recognize that underlying health conditions can actually reduce the probability and odds of landing in the hospital and having severe COVID-19. Why isn't the Biden administration offering similar messages to she didn't say this, but we all know that Americans have a health issue, have a rampant overweight and obesity and metabolic disease problem. And she kind of doesn't really respond that well. You're going to hear more about that. Then we have a clip, well, actually it's just an image, that Dr. Peter Attia, who we've had on the podcast before, I highly recommend you follow his work. He just did a phenomenal interview with Monica Gandhi, Zubin Damania, and Marty McCary, all about what are we going to do with this endemicity with COVID-19? And so we're going to break down that a little bit later, as in over the weekend. However, I have a great image that he talks about. And then we're going to continue to talk about all irrational things. In California, there's a big push to put N95 respirators on preschoolers. It's absolutely phenomenal. So let's first talk about how freedom is contagious, my friends. So I shared this over on Facebook, and I donated to the Freedom Convoy. I think it's really important to put your money where your mouth is when it comes to your health, when it comes to your food, when it comes to your dietary supplements, when it comes to supporting local farmers. And I donated to this Freedom Convoy because this is becoming a worldwide movement. We are sending the message to politicians and policymakers that, you know what? This is a personal decision. If you would like to be immunized and boosted, that's fine. Good for you. Good on you for doing so. But for many of us, we have already had the plague and we've survived the plague. And so therefore, we don't see the medical necessity, the added value of continuing on this path of infinity boosters to slow down the spread. So this is a personal decision. And as such, the onus should be on the individual, not the government, to mandate this. So please support the Freedom Convoy. I will put links below. And what I want to do is just, as we're talking here, just play this clip. Joe Rogan was sharing this. This gave me the chills. And since we have quite a few of you on with us, again, friends, if you're here, hit that like button. Please leave a chat. Let me know where you're from. Should we continue these Fear-Mongering Friday sessions? Let me know. But this clip gave me the chills. Let's just play this as we wait for more of our friends to get on, because this is becoming a global movement, and I think it's really needed. So here we go.
With cars, there's really nowhere to park, and just to give you a bit of a better idea, a picture, I'm just going to step out of the way here so you can see the parking lot right behind me. It is filled with people. People are honking their horns. A lot of Canadian flags, signs, all in support of this convoy.
Travelers acknowledged this is bigger than just that one issue.
We're fighting for our human rights that our forefathers fought for, and we want to make sure that we still have our freedoms and rights. It's not about, they're not anti-vax, they're not pro-vax, it's just about freedom of choice, freedom of rights that we've had.
The convoy is traveling across the country.
I want to say I'm so proud of you guys. You have my support. Go Truckers! Make Canada great again!
It started as a movement in Canada to ensure freedom for all, for the right for their own bodily autonomy. And in less than 4 days, we've grown to exponential numbers. There's literally people all across the world that is helping Canada come together and accomplish this movement right now.
My husband is a miner up in Baffinland, Nunavut, and him and a bunch of other people up there are rooting you guys on. He wishes he could be here for the 29th, but he'll be here in spirit for sure.
Keep up what you're doing, boys. Doing a hell of a job. The world is watching. But to the little child that asked for the horn blow,
truck drivers. I really want to go back to school and do sports. Thank you for all that you're doing.
I'd like to give a big thank you to everyone participating in the convoy, truckers and all the supporters.
All right, so
I'm going to try and do this without crying. This has been the first
this goes
time
on
in
for a
2
few
years
minutes.
I've had hope.
I mean, it's amazing. I don't know about you, but the first time I watched that, I had tears. I teared up. It gave me hope for the first time. In the last 24 months or so, it seemed as though people were never going to get it. We weren't going to wake up as a collective. It seemed that so many people had just been myopically focused on this pathogen and were able, or for some reason would, just give up their lives and their livelihood and isolate themselves socially from the people that they cared about. And it seems that people are done with that by and large. There's a small percentage of folks, and there was actually a New York Times poll. I don't have it right in front of me, but that was another thing that I wanted to address herein, is 68% of people who have been fully boosted are still scared of Omicron. And 65% of Democrats and only 22% of people who identify as Republicans share that same fear and had said that they have restructured their lives to prevent coming in contact with Omicron. Now, this is absolutely insane. As controversial as these vaccines are, what has clearly been shown with the data is they reduce the probability of severe disease and death. I mean, that's just what the data shows. I know people go back and forth on that. Let's just talk about this issue right now. So why are people that are boosted scared about catching Omicron? Has been shown. Kaiser Permanente did a preprint on the health servers, like 52,000 individuals as part of the study. 0% of people who got Omicron and had that genetically sequenced were put on a ventilator or died. I mean, I don't know why people are still scared. It's absolutely mind-boggling that we have a more mild variant and people are still acting insane. So, friends, that's why we are still talking about this. Now, before I play this clip from Jen Psaki, and CBS asked her this question, I think it's important that we just look at sort of where the situation is, right? We were told it was going to be 2 weeks to flatten the curve. Here's the curve now as of the 25th of January. As you can see here, hospitalizations, we have cases are at record levels. There's, over the last several weeks, there's been a 27% increase in cases. And so forth. So we know that that deaths have actually increased. There's been an increase in deaths according to several articles. So it seems prudent that we start looking at other solutions that we could potentially implement from a government level, from a public health standpoint, to help reduce the probability that people are going to die. Right? Doesn't that seem sort of that seems like logical, right? It seems to make sense. Well, here's what a reporter asked Jen Psaki, and I think. Kudos to CBS for asking these hard questions. It's interesting now that they're just now asking these things 2 years later. But here we go with CBS asking this very important question to Jen Psaki, who's the White House press secretary under the Biden administration. Listen to this question. I think it's really well asked. Here we go.
On COVID, we've seen an effort from a few other countries to include a push for living a healthier lifestyle as part of its pandemic response. There's been studies indicating efforts like weight loss could help prevent some of the more serious effects of COVID-19. Why isn't the president included a push for healthier lifestyles in his COVID messaging in addition to pushing Americans to get vaccinated?
Well, first, we rely on the advice and guidance of our public health officials on how to best protect yourself from hospitalization and death from COVID. And we know that the most effective steps anyone can take are to get vaccinated, get boosted, wear a mask, and those are the steps that we're certainly focusing on. If they decide those are steps that are warranted and have a huge impact on outcomes, and they want to share those, we'd certainly echo those, but we really refer to our public health officials and experts.
So that hasn't been advice from the public health officials that the president's been speaking to?
Again, we do briefings with our public health officials every week, multiple times a week, and I think what's most important to note is what we know is most effective, which is getting vaccinated, getting boosted, wearing a mask, and those are the components and the steps that we're really focusing our attention on.
Okay, so she goes on to talk about, as you just heard, all the sort of time-tested modalities and interventions that we've been applying to society at large, right? This massive vaccination campaign, hand washing, masking, social distancing, and so forth. But you notice she didn't really mention exercise. Well, I'm going to share with you about 4 of the many exercise studies that have clearly shown that exercise is a tool. We know that lifestyle intervention, we know that sleep, we know that eating a less processed food, moving your body after meals, going in the sauna. There's so many different modalities that actually have research. Now, look, I can go into the urinal, okay, on my iPhone and find these very papers. I don't have a team of members. I'm not being paid by the government $450,000 like some of our public health officials are. So I really don't understand the communication gap here, because if you go into PubMed or Google Scholar, both of which are able to aggregate information that is peer-reviewed, this information is widely accessible. Why isn't it being talked about? Again, we hear so much about protecting the vulnerable. There's a new term being thrown around, protecting the vaccinated vulnerable. Well, the vaccinated vulnerable should be getting recommendations from the public health experts about additional modalities that they can implement in their life to reduce disease and hospitalization. So here's a paper right here. I mean, you can read this for yourself. I'll just share this on the screen for all of you that are here with us live. The big mistake of not considering physical activity an essential element of care during the COVID-19 pandemic. Okay, these are from NIH-funded researchers. This is not from QAnon conspiracy theorists or the Journal of Bodybuilding Bro Science. This is from really, reputable public health officials, not officials, but people that do adequate research in public health, okay? Here's one intervention involving 1.5 million individuals from Sweden. This was in BMJ Open. Fitness, strength, and severity of COVID-19, a prospective register study of 1.5 million Swedish conscripts. And so what was interesting about this particular study was this was looking at data of individuals that went back like 20 to 40 years and found that individuals who, maintained their fitness level for a long period of time, these were folks that actually enrolled in the Swedish military and so forth, they had statistical differences and orders of magnitude differences in regards to outcome if they regularly exercised. And so we broke down the study in great detail. Again, I'm sharing this information with you. I know you know these things, but for some reason, it seems that our public health experts that are getting paid very generous amounts of money to make Americans ostensibly healthier, they're not conveying this message. So I just wanted to share this with you again. This, I think, was one of the most compelling studies. This was, conducted by our own Kaiser Permanente here on the West Coast. This was out of California. You can read the title here. Physical inactivity is associated with a higher risk for severe COVID-19 outcomes. A study in over 48,440 adult patients. This one I think is worth just pausing a little bit and breaking this one down. They found patients with COVID-19 who were consistently inactive had a greater risk of hospitalization. The odds ratio was 2.26, greater odds. You're inactive versus active, 2.26 greater odds of getting hospitalized. And then there was another, the risk of landing an admission to the ICU. The odds ratio in individuals who were active versus inactive, the inactive people had a 1.1 greater odds. Here's death, okay? Now, remember, there's no data showing that face masks prevent death, right? Jen Psaki said, oh yeah, this is why we have mandatory masking everywhere. There's zero evidence to suggest face masks prevent death. Let's just put it out there. Show me a study. If you know a study, let me know. Here we have a study showing that people who regularly exercise have an odds ratio compared to those who are inactive. The inactive individuals have an adjusted odds ratio of 1.3 times greater odds of dying. So if you don't exercise, your odds of dying are significantly higher compared to individuals who do. Like I said, Fauci could have saved so many lives. Rochelle Walensky, all the people that you've seen on television over the last several months, years, now 2 years almost. It's insane, right? Why haven't we been promoting this stuff? This stuff is really accessible. So we're going to continue on with Dr. Peter Attia. Then I want to get to your live questions here. It's fun to make fun of all the irrational stuff in the world and people that want to put N95 respirators on children. But of course, we want to get to your live questions. So friends, as always, thank you for being here. It really does mean a lot to me that you are here live. Thank you for that like button. Thank you for resharing this with your friends and family. And look, let's talk about solutions just real quick. I want to let you know, if you want to improve your health, okay, there's a lot of solutions over at our sister company. One of the most popular supplements in the last year that I've been noticing and seeing a trend in our customers and folks like you on YouTube and iTunes is berberine, taking berberine because it's been shown to be very effective in research. to support overall metabolic health. And there's a lot of great, it's like a fasting mimetic. It can help kickstart your fast. So if you want to save on some berberine, you can hop on over to our sister company, myoscience.com. I'll put links below for that, but it's just an effective way to sort of curb the appetite, kickstart your fast, and get some of the benefits that are linked with fasting. So we'll talk a little bit more about that later. Now, this was another phenomenal study out of South Korea. I'm just going to finish off one more, then we're going to get to some silly masking on kids, which is crazy. So in this study of over 212,000 individuals from South Korea, the title here is Physical Activity and the Risk of SARS-CoV-2 Infection, Severe COVID-19 Illness, and COVID-19-like related mortality in South Korea. And so this was quite fascinating because what they found is that people who regularly exercise dramatically lower odds. Again, just like the Kaiser Permanente study, just like the study in Sweden. There's another study on muscle strength that I, for some reason, I didn't put it in here, but tons of great research on fitness. So when Jen Psaki says, well, if our public health experts are able to somehow scavenge up some data, with a research team, give them a few months, I can find this like this, friends, on my iPhone. When I'm in on number 2, right? Like so it's like, why are we pretending that this stuff doesn't exist? It does exist. It is out there. Okay. So Dr. Peter Attia, who I have so much respect for, really just a great guy. He put out this tweet on, was it Tuesday of this week or something like that? Now, when you first look at this, it's a little complicated, but what he's showing is the top causes of death for individuals under the age of 35 over the last several years. Okay, now he's putting this in relationship to COVID-19 related deaths. And so these are multiples. So for example, motor vehicle accidents for people, and these are children between the ages of 0 and 5, for those of you listening in iTunes and so on. Motor vehicle accidents killed children 11 times on an odds basis, on the multiple, 11-fold more than COVID-19. Okay, now if you look here, it's suicide. Kids aren't killing themselves, thankfully. And you look at homicide. Look at homicide deaths, 9.5. There was 9.5 times more homicides in children between the ages of 0 and 5 compared to COVID. Now, you don't see parents in Chicago, New York, Baltimore, Philadelphia, LA mandating that children wear bulletproof vests, do you? No, you don't. In fact, you look at the motor vehicle accidents. That's a blue bar that you're seeing here. I see parents with their kids masked in the back of their seat. They're texting while they're driving their car, which makes zero sense. And as Peter says, it's logically inconsistent. And that's a problem. This is logically inconsistent. Now, let's look at between the ages of 15 and 35 here. 34. What you see here is drug overdose. No one's talking about the fentanyl and the opiates and all the other drugs that are being utilized by this age group. All we're hearing about now is putting N95s on our kids. And so this was an article here. Let me just read this to you. It's quite fascinating. This was an article in the San Mateo Journal. San Mateo is basically where Silicon Valley is. Okay. For those of you that can't read or you're just listening, the title here is Parents Scramble for KN95 and N95 Masks for School Children, which is absurd. In fact, before I read this article to you, I got to share this statistic, okay? This is directly from the American Academy of Pediatrics. Now, what I want you to focus on the 4th or 5th line down here, is California, okay? The number of cumulative child deaths from COVID-19 over the past 22 months is 47. Okay, it sounds like a lot, but many of those kids, as sad as it sounds, had underlying health issues that contributed or exacerbated, made the infection worse, okay? The total number of children in California is 8 million. Do the math. 47 divided by 8 million. Okay, we're talking about it's not even a rounding error. It's like 0.00000 whatever. I mean, this is an infinitesimally small number, okay? The cumulative, all of the deaths in California from COVID-19 are 77,000. So do that number. You like the percentage, and I have it right here. The percentage of children of all deaths is 0.06%, okay? But if you look at the pool of available kids that could have been infected and did get infected, it's infinitesimally small. And the percent of cases, in fact, the percent of cases that result in death in kids in California is zero. It's 0%. Like I said, it's such a small amount. But then what do you have here? You have parents scrambling, as this article says. Parents are scrambling for N95 masks for kids, for school children, as if we need that. So this is quite fascinating, and then I'll dovetail it to everything that we're talking about. Then I will get to your live questions. Here's a direct quote from the article. People are afraid to send their kids to school, so we're taking matters into our own hands, Chen said. It's become practice for districts to provide staff with those masks in some capacity, but few are providing them to students. Oh my gosh, because students don't need N95 masks, for goodness sakes. Some districts, like the Oakland Unified and West Contra Costa Unified, have ordered KN95s for students. Right, remember, because 47 kids in the entire state out of a pool of kids of 8 million need N95s to be safe. Blue, a sophomore in Oakland who did not want to share their last name, said wearing a KN95 mask at school is especially important to them when they got sick from COVID-19 over the holiday break. One of the worst COVID symptoms they experienced was an intense headache, Blue said, and at one point they even fainted. Oh, goodness. Even if you're fully vaccinated and young, COVID can be pretty rough in the body. I know this from personal experience, Blue said. I'm just trying to keep teachers and students safe by wearing a mask. Oh, hold on, Blue. You've already had it. What are you talking about? You've already had the thing. Do you really think you're going to get it again tomorrow? I mean, what is he even talking about? So as the country's dominant COVID strain, Omicron, is highly transmissible and more vaccine resistant, but generally less severe than other variants, parents and teachers are scrambling to collect N95 masks. I mean, I don't know about you. This is insanity. And we talked about this last week from Vinay Prasad. This has become self-perpetuating, religious, cultist-like behavior. And parents seemingly are under this erroneous assumption that their kid, if they get COVID, is going to die. Okay. As this Blue said, he might have got, I don't know what he or she got the Delta variant, had underlying health issues. I'm not sure, but you get a migraine, you feel a little tired for a few days and you move on. But this is what's everyone's going to get it. I mean, let's just be real. I mean, this is just kind of how the cards are going to unfold for many of us. So before I get to your live questions, I just want to let you know what's going on in Denmark. Earlier this week, Denmark lifted all of their COVID-19 restrictions, and they're going to return to life as we know it before Corona, which goes back to how we started this conversation off. Freedom is contagious. People are getting the illness. They're getting sick for a couple of days, and they want to resume life pre-COVID-19. They want to see their friends and family. They want to go to work. They want to go to a fitness center without wearing a face mask. They don't want to have to show a passport everywhere. In fact, my mother's gym, she lives in the San Francisco Bay Area. Okay, my mother's already had the virus. She has natural immunity. She has proof of it. In order for her to actually work out now, she needs to show proof that she has a booster shot, okay, which is insane. Anyway, I could go on with this stuff. I think you all sort of agree. We're in agreement with many of these different aspects of it, but it's just insane that we can show data like this. We can talk about how college kids, young people, young adults, individuals in their 30s are much more likely to die from something else. But that something else never really gets talked about. We never think about that. And that, as many have talked about, is logically inconsistent. It's not following the science. It's not maximally saving lives, like many have said. So before I get to your live questions, friends, I do want to let you know that you can save on our new t-shirts. We have this great new t-shirt, Eat Like Your Life Depends on It. Check it out. I'll put links in the description below. You can make a statement when you go to the grocery store, when you go to the gym, when you're hanging out with friends and family, and let them know that health is the path forward, my friends. So, as we are talking about this, I just want to highlight my favorite study. I'm going to put it right here because this is my favorite study, and then we are going to get to your live questions. So what sort of questions do we have? First of all, thanks as always for being here. Thank you for the super chat. I will get to that. That Kid See Rich says, it's so crazy that Fauci and these so-called experts could have saved many lives, but if they did, they wouldn't have made money off all this and so forth. So my thoughts on this whole thing is it's political. That's just, and I get in trouble for saying that, but I really think that this was just, there's just so much politics that went into this. Okay. And we're continuing to do that. So anyway, that's just my opinion. We've moved away from facts. Now we're talking about ideas. Bulletproof for kids. Yeah, I know. Wouldn't that be insane? Okay. Hello from Nanaimo Island. I love Nanaimo. Thank you for being here, Melina. All right. We have Carolyn says, Senator Ron Johnson, COVID-19, a second opinion on Rumble. Okay. I'll check that out. Thank you for that. Okay. Exercise mandates for kids. Seriously, where are those at? The schools are just ridiculous. So this is something else that we're doing. I'm part of a group. We're actually suing the school district in Washington State because they're not following any data. They say they're following data, but there's no data that they're following. And I want to encourage a lot of you all to go to the American Academy of Pediatrics website and get this data because this is right for free, right on the website. We all have access to this and we're not using it like we could and should be. So you should have this saved like on your frequently browsed tabs on your server or Evernote or notes on your computer, something like that. Because it's important. Mandate beef liver for children in school. Bert Nation 135. I'm in with that. Someone says globalism isn't mere politics. Yeah, no, I'm with you. Look, we're all speculating. We don't know what the real reason why all these things are happening, but yeah, I'm not sure. But anyway, we know that health is only being acknowledged in certain countries, which is interesting. Okay. Watching from Alberta. Thank you for being here. Sue says Democrats make their own data. I mean, you know, I have a lot of friends who are Democrats, and I've seen a lot of them come more and more to the middle, and we can have conversations. But when people are just far left, it's like, it's illogicalville.com. I mean, it's just crazy. Brian says vitamin C, D, quercetin, blah, blah, blah. Yeah. I mean, let's encourage those things. Honestly though, I have a supplement business. We sell supplements. Exercise is number one, hands down. I would just say that. But yes, vitamin D especially can be helpful. NAC for sure. Zinc, 100%. I'm with you. What else do we have? The fear-mongering needs to stop. Science shows the vaccines. Yeah, I'm with you on that. There are some interesting things. What other questions regarding health? Are there any? I mean, look, I know it's fun to poke fun at these different ideas, but any specific health questions on fasting, on exercise, on ketosis, on sleep, splitting ice water during workouts? Ooh, maybe. I'm not sure about that. Obesity is real. Our children are getting fat. I mean, isn't that the truth? And isn't that sad? Where's the school board meetings? I mean, dude, I get these emails every day. There's been another COVID case in our school. Okay, there's no need to call the school and ask which class the student has been in. The student is being isolated and is quarantining for 10 days. It's like, okay, but you're serving chicken nuggets and fish sticks and fake juice and crap for the kids. Like, where is all the outrage for the fake food that is being routinely distributed to these poor kids that is causing them to be freaking obese and overweight? No one seems to think that obesity as a 8-year-old is going to impact their life and their quality adjusted health later. Okay, newsflash, it does. We know that recidivism, obesity, being obese as a child, overweight as a child, diabetic as a child, autoimmunity as a child, guess what? Those conditions don't go away. Ask people who have Hashimoto's, ask people who have lupus, ask people who have MS, ask people who have colitis. You know why they have those diseases? Because they ate crap when they were children. We're feeding our children crap, but we're covering their face so we think it's just a wash. Oh, as long as we feed the children gingerbread cookies and fake chocolate milk and everything, as long as your mask is on, that's all that matters. It is so insane to me that parents don't see this. Like I've shared with you guys last week and gals, my daughter is in public school. We only have one child. She gets a lot of her social connections and so forth are through school. We did the homeschool thing. It just didn't really work out for her social development. Okay. So she's in public school. We deal with the masking thing, but she's one of 2 children out of 26 that bring their homemade lunch to school. One of 2. 2 of 26, rather. I mean, this is absurd. All these parents that care about their you know what? These parents are giving their kids phones when they're 8, but yet they're double masked. It makes no sense. Anyway, I could get really upset with this stuff. Okay. Do you see any downside to supplementing with citrulline? I don't. Citrulline is commonly present in supplements that are L-arginine-like boosters. I don't see any issues. Carla says, obese children, this would be child abuse. It should, Carla. It absolutely should. I don't know how that would, I don't know how that would get solved. I'm not a policy maker, but yes. Okay, great question here. Any value in eating for your blood type? Okay, this is a good question. I haven't read that book in a while. Look, I think eating commensurate with your heritage in general is a good idea. I've had some Indian clients. I've had some clients who are Asian. I've had clients who are Hispanic, okay? And they're trying to follow diets that are incompatible with their heritage, and it's not working for them. And I said, look, let's just pull it back and try to eat that is commensurate with sort of what your ancestors would eat. And so I think that's just a good principle to try. We can dabble in these therapeutic diets and implement intermittent fasting, nutritional ketosis, and we can do these different things with pretty good success. However, we do have genes, evolution, natural selection, intelligent design, whatever thing you believe in. Okay, our heritage influences how we adapt to our environment, so we have to recognize and acknowledge that. Okay, Brian says, I heard a 90-year-old nurse say the flu is caused by an increase in sugar intake and a decrease in water and sun intake. Hey, I'm on board with that. We know that we talked about this in a recent video. The environment, the milieu interior, and that was Dr. Bernard talked about this terrain model. Okay. Joseph Jones says, Docs in 2020 talked about how people would have recovered if it wasn't for the fear anxiety. Yeah. Well, and we reviewed that data from the CDC, and we talked about that, how anxiety was the second leading risk factor besides age and obesity in terms of death. So molecular hydrogen benefits, Leanne, that's a good question. Molecular hydrogen, I don't know anything about it. Yeah, I hear people talk about deuterium and hydrogen and blah, blah, blah. Look, I think honestly, these things are sort of splitting hairs. You have to walk after meals. You have to get sunlight. You have to get off screens in the few hours before you go to bed. You have to have good relationships. You need to compress your feeding window. If you're doing all of that stuff, and you're weightlifting, and you're not getting any benefit, then you start splitting hairs with molecular hydrogen, deuterium depleted water, you might get NMN, whatever the heck, right? But you got to be doing the basics, my friends. I think we ignore the basics, and we're sort of chasing this shiny object syndrome when we really should be focusing on the basics. I mean, let's just think about it like this. Let's say you have a roof leak. So you're like, you know what? I'm not going to work on the roof leak yet, but what I'm going to do, I'm going to get a super high-powered microwave in my house. Was that going to increase the value of your house? Maybe, but your house is going to erode if water continues to get into the house and create mold and other structural issues, you see? So we have to focus on the core essentials, the foundation first, before going after these sort of novel ideas. And look, I get it. I get excited about novel stuff too when these things come out. I used to take resveratrol, NMN, and all this crap, and I backed off on a lot of that, focusing on the basics: vitamin D, omega-3s, sulfur, little NAC here and there, melatonin, just really basic stuff. Okay. Just Me says it's a pandemic of government overreach. Well, isn't that the truth? The world over, unfortunately. But yes, why is that? Was it just an opportunity to make themselves look better? I mean, I'm trying to look at it from both sides. So if you're a politician, you see this virus ripping through, you know that if a lot of people die, then maybe you're not going to be reelected, right? So you think, because you don't understand health, you think that if you clamp down really, really hard, yes, that's going to crush the economy and so forth. But if you can actually be the one politician, because no politician outside of Sweden really did a good job at handling this, and they got a lot of flack. Everyone else basically sucked, right? In the end, they sucked, right? And they're giving up and just saying, look, we couldn't do it. We couldn't control an invisible microbe, right? Because it's invisible. So, I think the most popular politician, they wouldn't have been popular early on, but if they would have just said, hey, look, we're going to focus on making everyone healthier. Unfortunately, there will be some collateral damage. Some vulnerable people will die. But if you don't want to be vulnerable, cut out the sugar in your diet. Get 8,000 to 10,000 steps every day. Go to bed at 10 o'clock. Don't watch TV in your bedroom. Eat whole real food. Cook your food from home, right? If we did that, honestly, we'd be in a different place right now. Okay. My son unvaxxed got COVID 2 weeks ago. Okay. And how is he? Okay, Mindy says, can you elaborate a little bit more on this heritage diet? I was born and raised in Los Angeles. Mindy, I know that, but let's think about your great grandparents. Where are you a mutt? Where's grandma and grandpa from? Are they Polish? Are they Russian? Are they from, Yugoslavia? Are they from Ecuador? Start to think about that. And what did grandma and grandpa and great grandma and grandpa eat in Poland? Or in Mexico, or in Ireland? What did they eat, right? Okay. Mandy says, so many people are double masked in the grocery store, pushing carts full of processed crap. I know, it's insane. Don't even get me started, Mandy. Oh my gosh, it's ridiculous. Okay, we have Just Me. Again, Just Me, what's going on? Just Me says, there's no such thing as essential carbohydrates. I would agree with you on that. But I will say that you can have carbs as long as you exercise. Just think of carbs like a jacket, right? You don't wear a jacket when it's really hot out. You just wear it when you need it. And sometimes when you get warm, you take it off, okay? So think about sort of carbohydrates like extra layers of clothing. The more exercise and intensity you do, the more you can have. But if you're not doing anything, you don't need to eat a bunch. That's just how, we vilify carbohydrates thinking that they're just the devil. They cause all the problems, but it's really the overconsumption of carbohydrates and the under exercise. That's the challenge. All right. Leanne is German and Native American. Cool. That's awesome. So, do some digging. Talk to your grandparents, your parents, see what sort of culinary meals, you would have used or eaten back in the day. Someone has a sibling that has Guillain-Barré. Man, I'm sorry to hear that, Chris. That is tough. Your health, you decide, not your politicians. I like that, Plato's Crave. I really do like that. Mindy has another question here. Is experiencing diarrhea while fasting meaning that the toxins are being released? Experiencing diarrhea with fasting is probably just a reduction in bile output, or accumulating bile. So it's not a detox necessarily. This might just be a little transient thing. So just sort of work through it and see what happens. You might benefit from some bone broth. You might benefit, from some very low calorie, maybe some olives or something like that. So, really great questions here. Thank you all for being here. Bryant E., have you seen Joe Rogan's podcast with? Yes, I have. Excellent conversation. I definitely think those guys are great. Okay. Okay. Kyle O'Neill, great question here. In regards to the importance of sulfur in the diet, how do you approach clients with those who have sulfur intolerance? Yeah. So would that be like if you have onions, you get really, or garlic or something like that? Or is it like if you take NAC, what happens if you take N-acetylcysteine? What happens if you have meat? Remember, sulfur is not just in brassica, vegetables. It's not just, in onions or garlic. It's also methionine. It's coming from your diet, and other sulfur, taurine, and other sulfur-containing amino acids and so forth in animal products. So if you're okay eating meat or having some dairy, you're getting sulfur as well. Okay, last question here. And again, I want to thank all of you for being here. Thank you for hitting that like button. Thank you for your great chats. Great question here from Caliph Mom of Two. Caliph Mom of Two says she recovered from Omicron 2 weeks ago. Hold on here, something happened to my camera, but I'm going to continue on here. Recover from Omicron, wondering what levels of supplements to start shifting after therapeutic dosaging and so forth. So, so you'd want to drop down, your zinc to maybe 25 milligrams a day. There's no real medical need to keep it cranking beyond that at any point. So that would be something that you could consider. Of course, you can continue to take glutathione and all that, but I don't really see a major need to take glutathione continually. So just understand, that. And what else? Your vitamin K would be just, I would definitely continue the vitamin K. And gosh, I think that's a good plan there. My camera just went out. So you can see my room here. All right, so we are back. What else do you have on there? You could take your vitamin C. I mean, it's water soluble, no harm with that. Molybdenum, I mean, you could take that, if you want. Vitamin K, of course, you can continue that. But do you need to crank glutathione continuously and vitamin C? I would say if you've had allergies or autoimmunity, you might benefit from the glutathione and the vitamin C, but you can definitely overdo the zinc. And so that would be just something to be mindful of. Heavy metals deplete glutathione, as do persistent organic pollutants and endocrine disrupting chemicals. So that's a great point there. What else do we have here? I take 90 milligrams of zinc daily. Yeah, that's a lot. I wouldn't do that for a long time. You could, if you've been doing that for a while, you could back it down to 25 milligrams or 30 milligrams. Because zinc and copper have a delicate balance, and so you could overdo that. Okay. What else do we have here? What does vitamin K do? Yeah, so vitamin K helps to put calcium into hard tissues as opposed to soft tissues. So we know that vitamin D is involved in calcium homeostasis and balance, but we know that vitamin K can help to make sure that the calcium that the vitamin D is helping to sort of mobilize goes into the right tissues. You don't want calcium to get into your arteries and the soft tissues and things of that sort. So that's what I would suggest. So I was going to say calcium. Vitamin D and K combinations. Let's see. I don't have any shots that I can. Actually, I do. I can share this with you right here. I can just plug this since we're talking about it. Again, we can't diagnose, treat, cure, prevent disease, but I will just put this here for you. So the Myoscience Essential Fatty Nutrients, nice combination of K2 and D3. So if you're taking D, you should be taking K. Really affordable, 90 micrograms. This particular product has 75 5-star reviews. So I think you would probably like that blend. So great question there on the vitamin K. Okay. Let's see here. I like these questions. How do I lower elevated iron? Donate blood. Joanne. So Joanne, how old are you? This is, really important for women to hear that are postmenopausal, peri or postmenopausal. Donate blood. But you also want to look at your hemoglobin, hematocrit, and your ferritin. It's not just your iron. So there's a little bit more to that, but really important stuff for donating blood. So yeah. Okay. Missy says, how do I get my taste and smell back after the thingy? Right? Okay. Can someone tag a video? You know what I'm going to do? I guess I can find this on my own channel. Why not? I will go to a video that we did about a month ago, and I'm going to drop it in the chat here. So I'm going to drop this in the chat. Give me a quick second. And this was actually live that we did. So this has all the tools that you need with regards to taste and smell. So Missy, please give this a chat. It's linked below. Just Me Again says donate blood. We're on the same page. Actually, I donated blood this week. It's cool. Okay. It's OTC test for zinc. Yeah, there is an OTC test, and we have a zinc citrate that can help with that. LDN for Hashimoto's. Yeah, that's a good question. So, of course, you could try. Yeah, I mean, there's a lot of things that you would want to do first before diving into LDN. Not that it's bad, but just understand that. But for sure, you can. There's a lot of things that you can do, but I would first get off the gluten, get off the dairy, get off the corn, get off the soy. Okay, cover the basics there. Go on a low histamine diet, so not a lot of wine, beer, ferments, things like that. Make sure you're exercising. Make sure you're sleeping. Rule out mold toxicity in the home. Make sure if you get dry cleaning and all the perfumes and everything, the cleaning products, the female products, all of that, make sure that they're paraben free, chemical free. Okay, so you're doing all that. You're exercising. Maybe you're doing yoga. You're walking. You're getting sunlight. You're doing all that stuff. Then consider potentially LDN. So I wouldn't just say, oh, I have Hashimoto's. I'm just going to go on this thing. You got to do all of that other stuff first, okay? But I've had some folks that are working with individuals with LDN and having great success with that. Okay. All right. Top 4 levels after thyroid. Okay. Yeah, Denise says stay away from that plastic in food. Yeah, for sure, Denise. Thank you for that. Yeah, cool. Fasting can actually help. I know it's controversial with regards to these different things like Hashimoto's, but fasting can be helpful. Well, friends, I just want to thank you for being here. It's always fun to connect with you live. One day we're going to do one of these seminars. So I would love to know where you're from. Leave in the comments where you're from and where, if you would like to do a live event. And if someone leaves a comment, like if you're in San Antonio or if you're in Los Angeles or if you're in Houston, whatever, just hit that like button on that comment, like the comment so that I know and we can start planning, because we are planning events this year. Because most cities are like done with restrictions on how many people can be in an event and all that. So we're going to do live workshops to focus on health. And I would like you to be there. I want to meet you in person, want to talk to you, want to hear your story, want to help you, because everyone is a little unique in their journey and we want to bring people together. Because if you know that you're part of a tribe, a team, that people are cheering you on, you're going to make that healthier choice. You're not going to hit up McDonald's or Chick-fil-A or Taco Bell. You want to cook food from scratch or hit the healthy restaurant. So that's what we're trying to do. So a lot of folks from Canada, Omaha, San Jose, Sydney, Australia. I would love to go to Australia, but I mean, give me a break now. They won't let me in. New Jersey, we got Boise, Idaho. All right. So Boise, that's okay. Tampa, Florida for sure. That's where we already have that in the works. We got Parksburg, West Virginia. We got New York, Long Island. All right. Well, can you go into New York without a vaccine? I mean, like for real? Can you? If so, I'm all in. Salt Lake City for sure. That's already in the works. Central Pennsylvania. What else we got? Sacramento. All right. Sacramento, doable. Sacramento, July for sure. Sacramento, July, 100%. We're already working on that. We got Arizona. Okay. Dave, where in Arizona? We're talking Scottsdale, Tucson. What do you got? Vancouver, BC, Vancouver, Washington. Sedona. All right. That could be cool. Brooklyn. We got Chicago for sure. Oh man, I love the Chicago burbs. So I'm in, but that's going to be more like June, because it's Chicago. Middle of Texas. All right. Chicago. Okay. A lot of Chicago. East Coast. More Idaho. Heck yeah. Minnesota. Okay. We're looking at March for Minnesota to do an event. March in Minnesota. Okay. We got New York. A lot of New York. We got Washington, a lot of Washington. We got Phoenix, we got Denver. Lancaster, okay. So LA, I'm trying to think like where in LA would be good. Hawaii, well, that would be amazing. maybe, okay, a lot of Washington, New Mexico, Virginia is coming up again. We got Chicago again. We got a lot of folks from Chicago. Can you hold events in Chicago right now? Or is Lori Lightfoot all over that, like white on rice with the restrictions? Austin, San Antonio, upstate New York. Okay, Dallas. We got Everett, Washington. We got Toronto. We got, man. All right, we got, it's cool to see where you all are from so that we get an idea. Ben says Australia is shit at the moment. I know, but I'm sure over time it's going to get better. I sure hope. We got Michigan. Cool. There's a lot of Chicago. Man, all right. Costa Rica. Cool. Are you going to wear a mask to travel? I mean, you kind of have to on an airplane, but do I feel a medical necessity to wear a facial covering when I'm traveling? No, I do not. What else we got? The White House. Yeah, for sure. Pray for New York police. Man, it's a damn shame. And Houston. The inner cities need us. Yep, Mindy. The inner cities need some help. Durango. Dubai. I would love to go to Dubai. So, friends, I'm super grateful that you tuned in live. Hopefully you have a healthy and fun weekend. Thank you for that like button. Thank you for your comments. We got Greensboro, North Carolina. We got Maine. More from Chicago. Dude, all right, we're going to the Midwest. That's it. We're doing it. Colorado. We've only got one from Colorado. What the heck? Dinner with Fauci. Could you imagine? Dude, I'd be down. Would it happen? No. But I would be game. Just like, off the record, why haven't you talked about exercise? Like, just shoot it to me straight. Like, what's going on? Yeah. So we got Swamp Hawk in the house. Anyway, friends, thanks for being here live. Thank you for watching the replay. I really, really appreciate your comments. We got more from Durango, Colorado, which is great. Coachella Valley, which is awesome. So we are going. I need to eat with my family, believe it or not. And I'm sure you do too. So thank you all for being here. Hopefully you got some value. Thanks for hitting that like button. And freedom is contagious. Remember that freedom always wins, friends. People have died for freedom. That's what we're seeing here with this freedom convoy that I think has just taken off. And let me just add this last thing here. Please support the freedom convoy. I personally donated 1,000 Canadian, which was like $770 some odd USD. So put your money where your mouth is, friends. Buy food from a local farmer. Go to the farmer's market instead of Costco or Whole Foods. Keep it local. That's how you become healthy and support the health of the world and the environment. So vote with your dollar. Please support this freedom convoy and support your health. Go for a walk this weekend. Try not to drink too much. Try to cook your food from scratch. We'll catch you all soon. Very grateful for you tuning in. Bye now.